Let me introduce, I'm Jan BOGAERT from Leuven, Belgium. I'm a cardiac radiologist, and having been in the field of cardiovascular magnetic resonance for the last 25 years, and during these years I really have experienced the huge progression of this imaging modality in the field of cardiac imaging, cardiac pathology, and this technique has become over the years what we can call a patient and disease oriented approach. And one of the major game changers has definitely been, let's say, around in the beginning of the second millennium, has been the introduction of the late enhancement imaging modalities, allowing to really visualize very subtle myocardial pathology in the order of, let's say, 1 gram of myocardial damage and even less. And this really has changed our approach at looking at myocardial pathology, and we were able to discriminate using the late enhancement imaging technique to differentiate ischemic from non-ischemic patterns of late enhancement, and also in the group of the non-ischemic enhancement patterns to differentiate different types of enhancement, bringing us really very close to the underlying pathology. Although late enhancement has been really a superb technique, it focuses a major shortcoming being that if you have a diffuse myocardial pathology, the disease may be missed. And that was the aim, or is the aim, of my talk here in Athens, bringing the audience a sight of how the technique will evolve over the next years. And what is getting more and more introduced is what we can call the myocardial mapping techniques, bringing us through quantitative data with regard to myocardial relaxation times. And relaxation time is tissue specific. So if you have underlying focal disease, it can be fibrosis, it can be water, it can be lipids, it can be iron. This can be quantified using these mapping techniques. And we have different kind of mapping techniques. We have the T1 mapping technique, we have the T2 and the T2 star mapping techniques. And each of these techniques can be introduced or can be used to visualize specific myocardial pathology. And if you combine the late enhancement and the mapping techniques, we will be able to bring a more comprehensive view of the underlying myocardial pathology. And the aim of my talk is to show different pathologies, mainly in the field of thick-walled ventricles, and how the mapping techniques can add in fine-tuning the diagnosis. Thank you.